This is demo 3, and we are doing the heart. My name is Preston.
I am John.
I'm Emily, and Maddie is behind the camera.
So main structures of the heart, there are 4 chambers, 4 valves. Of the chambers, there's a right atrium, right ventricle, left atrium, and left ventricle. Of the valves, we'll have a tricuspid, a pulmonary valve, a bicuspid valve, and a aortic valve. Going into the heart, you'll have an inferior vena cava and a superior vena cava. You also have an aorta that is leaving the heart. And there are also pulmonary arteries and veins that are leading the heart towards the lungs.
So I'm going to tell you about the atrioventricular valves of the heart. They are also known as the AV valves. These valves allow blood to flow from the atria to the ventricles, and they also prevent backflow from ventricles to atria. So the first one is the tricuspid valve. It goes from the left atria to the left ventricle, and it is composed of 3 leaflets called the anterior, posterior, and septal leaflets. The next AV valve is the bicuspid or mitral valve. It goes from the right atrium to the right ventricle, and it is composed of 2 leaflets, the anteromedial and posterior-lateral leaflets. The AV valves are strengthened by papillary muscles in the ventricles. These muscles attach to the AV valves via the tendon chordinae, and they prevent them from prolapsing and letting blood flow backwards. Next, we have the semilunar heart valves. These valves allow blood to flow from the ventricles to the arteries, and they also prevent backflow from the arteries back into the ventricles. So first, there is the pulmonary valve, and this valve lies between the right ventricle and the pulmonary artery. The next semilunar heart valve is the aortic valve, and it lies between the left ventricle and the aorta. The name semilunar comes from the fact that at certain angles, the valve cuffs appear to be shaped like half moons.
So next we have the coronary arteries, and they're pretty much going to be the right and the left, as you see there. And there's different branches to them, but they're going to be commonly known as the right-left coronary arteries. And the main function of these is to supply blood flow to the myocardium, which is the muscle contraction layer of the heart. And it's going to be very common for these to drain into the coronary sinus, which is an innermost layer of the heart. And this is very prominent in the clinical setting as CAD, which is when one of these arteries becomes blocked, can lead to the development of like a heart attack. And so it's prominent, like I said, there's 3 million cases a year. And yeah.
The heart has a pericardium that surrounds it, and this pericardium is composed of 3 layers. First, we have the fibrous pericardium. This layer supports and protects the heart, and it also anchors the heart to the surrounding chest cavity. The next layer is called the parietal pericardium, and it forms the outer layer of the pericardial cavity. The innermost layer is the visceral pericardium, and it lines the heart and forms the inner layer of the periocardial cavity. Together, the parietal and visceral pericardium make up the serous pericardium. So inside of the pericardium is the pericardial fluid, and this fluid provides lubrication between the serous and fibrous pericardium layers, and this fluid allows the heart to expand and contract. So a common analogy for this layer of the heart is a balloon. So either side of the balloon is the fibrous and serous pericardium, and inside the air would be the pericardial fluid. So when the heart contracts and pushes against it, it allows for some lubrication and protects the heart while it contracts.
All right, so next we have the myocardium, which is the innermost layer of the heart. And this is going to be the layer of the heart, as you can see here, that receives stimulation from the vessels leading into the heart. And it's going to surround the 4 chambers, the right ventricle, right atrium, and the left ventricle and left atrium. And it's going to receive the stimulation to contract, and that'll initiate the pumping through the different valves within the heart.
Hello! So the next thing I'm going to do is walk you guys through the blood flow through the heart. So starting out, we're going to have deoxygenated blood enter the superior and inferior vena cava. It will then go through the right atrium and then go across through the tricuspid valve into the ventricle. After entering the right ventricle, it will then go out through the pulmonary semilunar valve, through the pulmonary trunk, and then out the left pulmonary artery. After that, it is now entered the lungs and become oxygenated blood. It will come through the left pulmonary veins into the left atrium, where it will then go through the mitral valve into the left ventricle. It then will exit the left ventricle through the aortic semilunar valve and into the aorta and out to the body. The next thing we're going to talk about is electrical conduction. So the two main parts of electrical conduction kind of involve the SA node and the AV node. So the SA node is considered the pacemaker of the heart. It kind of determines our regular heartbeat when we're resting, so between 60 and 100 beats per minute. And then the AV node is the link between the atrial and the ventricular depolarization. So initial excitation occurs in the SA node and then travels throughout both atria. After that, it immediately goes to the AV node, which will cause the ventricles to contract.
All right, so heart function. We're going to have a pulmonary and a systemic circuit. In the pulmonary circuit, we are going to move the blood between the heart and the lungs. We bring deoxygenated blood to the lungs to release CO2 and take up oxygen. In the systemic circuit, we move the blood between the heart and the rest of the body. We bring oxygenated blood to the body tissues and deoxygenated blood to the hearts.